Hello dear friends, welcome to Nurses Ladder. So today in this video I came to talk about a specific topic related to NABH. So the topic is care of vulnerable patients, as you have already seen this in the thumbnail. Dear friends, before moving into this video, I would like to request that if there is anyone who is new to my channel and who is interested to watch videos related to nursing profession, healthcare or NABH, then you can better subscribe to my channel, and as soon as you subscribe, you better press the bell icon for getting notifications related to new videos. So my dear friends, let's start this video. Before moving into the topic, that is the care of vulnerable patients, let's know who is a vulnerable patient. So vulnerable patients are those patients who get admitted into hospital who are not able to take care of their basic needs and are dependent on others or healthcare workers for meeting the basic needs, and also they are very much prone for injury and infection. So this is a definition of vulnerable patients. Now let's move into the different categories of vulnerable patients, means which patients are put into the category of vulnerable patients. So let's see that. The first and foremost group of patients which belongs to vulnerable patients are senior citizens. That means patients whose age are more than 65 years. And then we got babies and children, mentally challenged patients. So here we need to check, as soon as the patient gets admitted in the emergency room, the healthcare professional has to check if there is any present or previous history of psychiatric illness. So you are supposed to check on this history. It is very important for us to know if the patient has got any psychiatric illness, even if it is a present or past. Then say next is physically challenged. So physically challenged patients could be, it can be in the form of any kind of disability, handicap, loss of vision, hearing. Okay, so these kind of losses make the patient to be vulnerable. And next is unconscious patients. So unconscious patients could be the patient specifically. You can find these patients in intensive care units. Specifically those patients who have recently had surgery, who is under the effect of anesthesia. That means within the first 24 hours after the surgery. So you are supposed to take care of these patients carefully, and also you should also put these patients into the category of vulnerable patients. And next is sedated patients, patients who are under sedation, specifically with sedatives and hypnotics. Specifically you can find these patients in intensive care units. Then patients who have got language barriers, who are from different countries or different parts of the same country, who speak different language other than the healthcare professional. So you need to have an interpreter in that case, so as to make it easy to communicate with these patients. So these are the group of patients who could be put under the category of vulnerable patients. Now let's see how we can care for these patients. It's not about the responsibility of a nurse. It's all about responsibility of all the healthcare professionals to take care of vulnerable patients, because vulnerable patients could be found in any of the wards in a hospital. It's not only about intensive care unit or a recovery room or post anesthesia care unit. It's all about different units where you can find these patients. So all healthcare professionals must be aware of who are those patients who must be put under the category of vulnerable patients. In specifically those hospitals who are in the process of getting accredited with NABH, there are specific color codings for even for vulnerable patients. The most suited or the most used color coding for vulnerable patients are orange color coding. So you can have a tag, okay, you can have orange colored tag which you can place on the over the foot end of the bed, which indicates that this patient is a vulnerable patient. Even on the like the patient's identity badge, you can have a sticker which has a orange color coding. So these could make the healthcare professionals to understand that this patient is a vulnerable patient and this patient needs special care. So these are the specific points which I wanted to address. So now let's see, how are you going to take care of these patients? As soon as you introduce yourself to the patient, before taking care of the patient, you're supposed to make sure that the side rails are always up, raised up. Okay, if the patient is not if you are not using, if you are not going to do any procedures, you must make sure that you have to raise the side rails. And also, if there is any attendant patient relative who is there with the patient, you have to educate them to make sure that the side rails are always raised up. Next is toilet wall handlers and call bells. The relatives must be aware of these while they are with the patients. So you have to make sure that the call bells as well as the toilet wall handlers are in function. Safe transportation. The healthcare professionals who are accompanying the patient for investigations or for any transportation to the OT, operation theatre, for any such surgeries, you have to make sure that the patient is being transported safely. That is transportation of the patient from stretcher to bed or from wheelchair to bed. So you have to make sure this transportation must be done safely, and there has to be bells while you transfer the patient, even if the patient is transported in a stretcher or a wheelchair. So it has to be functioning. And next, you have to always accompany the patient even if the patient is going to bathroom or the patient is being taken to any investigation or any other, if the patient is being transported to other unit, you're supposed to accompany the patient. You're not supposed to leave the patient alone, because there is a high chance for patient to have a fall. Next is the floors. The floors of the hospital unit, healthcare unit, must be non-slippery. It is a must. Okay, so you have to make sure that the floors must be non-slippery. And next, slopes and ramps must be with the railings. This is specifically for those patients who are physically challenged or disabled. So you have to make sure that the slopes as well as ramps must be with the railings. So these are the specific care which you need to provide, you need to take care of while you're caring for a vulnerable patient. Now let's see special points, extra points which you need to make sure. First one is prevention of infection. As I already mentioned that in the definition itself, I already mentioned that vulnerable patients are more prone for injury as well as infection. So you need to make sure that the patient is being taken care of in order to prevent certain infections, specifically hospital acquired infections such as CORT, CLUBC, even peripheral line associated infections, infections specifically that is related to IV cannula, and also surgical site infections. So these infections must be prevented for these patients. And next is personal hygiene. As the patient is not able to take care of himself or herself, and the patient is completely dependent on the healthcare professional, we have to make sure that the personal hygiene of the patient is being maintained. And also taking care of patient's mouth and also the back. Okay, so back care must be given as per hospital policies in order to prevent pressure ulcers, and also mouth care must be provided to the patient if the patient is not able to do so. Next, feeding. So here we need to check what is the activity level of the patient, how much does the patient has an appetite, how much the patient can do, eat the food. So whether the patient is being self-feeding, on self-feeding mode, or if the patient has to be given feeding through NG tube. Okay, so this must be taken care of. And next, care of bowel and bladder. And also you need to see whether the patient is being given medications in proper time. That means you need to follow the rights of drug administration while you are taking care of these patients. So my dear friends, I hope you got some idea about taking care of vulnerable patients. My dear friends, if your hospital is being is in a process for accreditation to NABH, it is very important for all the healthcare professionals to know who are vulnerable patients, how to take care of these patients, how we can prevent injury and infections for these patients so as to have a good, safe and quality-based patient care services. So thank you so much for watching this video. If you really like this video, please press the like button and also subscribe to my channel for getting more videos like this. Thank you so much. Take care and bye-bye.